So the materials you'll need are sperm, an egg, and an arrow. These can be made out of any material. On the back, you should have some way of putting it on whatever surface you'll be teaching on. So that could be a magnet, tape, sticky tack, whatever you desire. Also, there are diagrams that you'll need. This is the internal male anatomy, internal female reproductive anatomy, and this is the fertility cycle. For both of these drawings up here, you're mainly going to be using them to talk about physiology and function, so it's not important that they're incredibly accurate or to scale, as neither of these are. In the internal reproductive male anatomy, you'll point out a few of the important components. We have the testicle right here, the epididymis along the back, and the vas deferens connecting it to the ducts and stuff, which is just a generic term for our ducts and our glands that will create the seminal fluid. Then you have the urethra, and of course the outline of the penis and the scrotum. So in the internal female reproductive system, we have the uterus, the vagina. There's a little bit of demarcation for where the cervix would be, both of the fallopian tubes and ovaries. In a fertility cycle, you'll divide it up into 3 phases. The first is the menstrual phase, the second is the proliferative phase, and the final is the secretory phase. You'll start by pointing your arrow upwards and making a mark for day 1. You'll then explain the menstrual phase. Next, move your arrow downward. It's pointing to the proliferative phase. Make a mark at day 14 whenever you're discussing ovulation. Finally, you'll move your arrow to the secretory phase and explain that. Then you're done with your discussion of the fertility cycle. Next, move on to the male anatomy. Take your sperm and starting with it in the testicle, move it through the reproductive tract as you explain its journey. Now it's time for the sperm to take its journey through the female reproductive tract. We'll start with the sperm in the vagina and then move it upwards through the uterus and into the fallopian tube. Now, take your egg and place it into an ovary. As you explain ovulation, refer back to the fertility cycle and move the egg into the fallopian tube next to the sperm. Finally, explain fertilization and then move on to the pregnancy activity that follows this one.